Do your moods shift faster than they used to, without a clear reason? On Wellness 60 to 100, your trusted channel for healthy aging, we explore how unexpected mood swings in older adults may be more than emotions. They could be the brain's early signal of silent, ongoing decline. Don't overlook the warning. David, a 69-year-old retired firefighter from Florida, had always been calm and steady. But over the last year, something changed. Small things, like a misplaced remote or a delayed dinner, would send him into bursts of anger. Moments later, he'd withdraw, staring blankly into space, unable to explain why he got upset. His family assumed he was stressed or frustrated with retirement life. His wife thought maybe he just wasn't himself lately. But David insisted he felt fine, even when the emotional outbursts kept coming. Concerned, his daughter convinced him to see a neurologist. After a detailed evaluation, David was diagnosed with early temporal lobe atrophy, a form of silent brain decline that affects emotional regulation long before memory begins to fade. His mood swings weren't psychological, they were neurological. David's story isn't unique. Many older adults experience sudden shifts in mood, anger, sadness, apathy, without understanding why. Often, the root cause is deterioration in brain regions that manage emotional balance, such as the temporal and frontal lobes. These changes can be the earliest signs of cognitive decline, but because they're emotional, not memory-based, they're often overlooked. And that delay can cost precious time for early intervention. I'm Dr. Emily Carter, a board-certified geriatrician. When older adults begin experiencing sudden or unpredictable mood swings, it's not always psychological, it may be neurological. Emotional regulation depends on brain health. Early damage in areas like the temporal or frontal lobes can cause silent decline that starts with emotional shifts, not memory loss. We need to notice these early signs. Sudden mood changes in older adults are often dismissed as stress, personality shifts, or just getting older. But on Wellness 60 to 100, your reliable source for healthy aging, we reveal a deeper truth. These mood swings may signal early dysfunction in the brain's emotional control centers. Long before memory fades, the brain may begin to falter in how it processes frustration, empathy, or calm. If left unrecognized, these early signs of neurological imbalance could lead to full-blown cognitive decline. In this episode, we'll show you how to identify dangerous mood shifts, understand their biological roots, and take early action to protect brain health and emotional well-being. As people age, it's natural to experience some emotional ups and downs. But when mood changes become frequent, intense, or unpredictable, they may signal more than just irritability or fatigue. They could be signs of silent neurological decline. So what separates normal emotional changes from concerning mood swings? 1. Sudden emotional outbursts. If a calm individual starts having unexpected outbursts, yelling, crying, or showing rage over minor triggers, it's a red flag. Especially when they later seem unaware of the intensity or quickly return to a flat emotional state. 2. Rapid switching between emotions. Mood swings become worrisome when they occur within minutes or hours, not days. For example, a senior might go from laughing to shouting to total withdrawal in the span of an afternoon, without understanding why. 3. Lack of emotional insight. A healthy person often knows when they're irritable or down. But someone experiencing neurologically driven mood swings may deny any issue or act confused about what just happened. This lack of insight can be a hallmark of early frontal or temporal lobe dysfunction. 4. Emotional extremes without obvious cause. We all get upset by stressors. But concerning swings happen without clear triggers, or the response is way out of proportion to the situation. 5. Changes in personality or social behavior. A once kind, patient grandparent becomes argumentative or emotionally cold. Friends and family may feel like the person is different, even though memory seems intact. These signs can appear before cognitive symptoms like forgetfulness or confusion, and because they're emotional, they're often dismissed as psychological. But mood regulation depends heavily on brain structures and chemical balance. If you notice frequent, uncharacteristic mood swings in a loved one, especially paired with detachment or poor self-awareness, it's time to look deeper. These shifts may be the brain's first cry for help before more visible decline begins. Mood regulation isn't just a matter of personality or willpower, it's a delicate process controlled by specific regions of the brain and a balance of critical neurochemicals. When these systems begin to break down, especially in older adults, the result can be rapid mood swings that seem to come out of nowhere. Let's break down the key players. 1. Frontal lobe. This is the brain's decision-making and emotional regulation center. It helps us pause before reacting, control impulsivity, and assess social behavior. Damage or shrinkage in the frontal lobe, common in early stages of frontotemporal dementia, FTD, can lead to emotional volatility, inappropriate responses, and mood instability. 2. Temporal lobe. Especially the amygdala and hippocampus, which regulate emotional memory and responses to stress. Early deterioration in this area, seen in some forms of Alzheimer's, can cause intense mood shifts and anxiety. 3. Limbic system. This includes structures like the hypothalamus and cingulate cortex, which integrate emotional signals with hormonal and nervous system responses. Disruption here affects emotional balance and stress response. 4. Neurotransmitters, dopamine and serotonin. These chemical messengers play a huge role. Dopamine is linked to motivation and pleasure. Low dopamine can cause apathy and emotional dullness, while irregular spikes may trigger agitation or mood swings. Serotonin influences mood stability. When levels drop, seniors may experience irritability, impulsiveness, or sadness that doesn't match the situation. 5. Vascular changes. Mini strokes or reduced blood flow can silently damage mood-regulating areas, especially in those with high blood pressure or diabetes. These changes often go undiagnosed until behavior noticeably shifts. When these structures or chemicals become imbalanced due to aging, disease, or inflammation, emotions can become unpredictable and unregulated. Recognizing that mood swings may stem from brain function, not just emotion, empowers families to act early, seek medical evaluation, and preserve quality of life. Emotional instability in older adults is often dismissed as a mood issue, but in many cases, it's the earliest warning sign of an underlying neurological disorder. Understanding which conditions are linked to unpredictable emotional changes can help families catch decline before it progresses too far. 1. Frontotemporal dementia, FTD. This condition affects the brain's frontal and temporal lobes, key regions for behavior and emotion. People with FTD often show disinhibition, apathy, or sudden mood swings long before memory problems appear. A kind, calm person may become impulsive, angry, or emotionally detached with no warning. 2. Alzheimer's disease, early stage. Although primarily associated with memory loss, Alzheimer's can also affect emotional processing. In early stages, seniors may cry unexpectedly, become irritable, or react to minor frustrations with anger. These signs can precede noticeable cognitive symptoms. 3. Parkinson's disease. Beyond tremors and movement issues, Parkinson's often disrupts dopamine pathways, leading to mood swings, anxiety, and depression. Some patients experience emotional outbursts or emotional numbness, which families may misinterpret as mood disorders. 4. Vascular dementia. Caused by reduced blood flow or small strokes in the brain, this condition can damage emotional regulation centers. Emotional volatility, crying, snapping, or withdrawing, can happen suddenly, especially after a silent stroke. 5. Normal pressure hydrocephalus, NPH. A lesser-known condition where excess cerebrospinal fluid puts pressure on the brain. Mood shifts, apathy, and behavior changes often occur alongside walking difficulties and urinary issues. 6. Mild cognitive impairment, MCI. Even in this pre-dementia stage, some individuals show emotional sensitivity, impulsive reactions, or low frustration tolerance. These may signal changes in emotional control systems. When a senior's moods shift erratically without obvious cause, it's crucial not to blame aging or personality. Emotional instability can be the brain's first distress signal, alerting us to deeper changes inside. Early recognition opens the door to diagnosis, planning, and compassionate support. As we age, emotions naturally shift. Life transitions, physical limitations, or grief can affect how we feel and react. But how can we tell the difference between a normal emotional response and a more concerning, brain-based mood volatility? Here are key differences to look for. 1. Context matters. Normal emotion is typically linked to a clear cause. Sadness may follow loss, and frustration may follow pain or limitation. In contrast, brain-related volatility often occurs without context, a burst of anger over nothing, or sudden tears during a calm moment. 2. Proportionality. Typical emotional responses are proportionate to the situation. Getting mildly upset about a forgotten appointment is expected. But yelling, slamming doors, or falling into a silent rage over a misplaced key may point to emotional dysregulation. 3. Duration and recovery. Normal emotions come and go with some self-awareness. A person might say, "I was upset earlier, but I'm okay now." Someone experiencing brain-driven volatility may not acknowledge their behavior, or seem confused when asked about it. 4. Emotional self-insight. Healthy individuals usually understand and can describe their feelings. Those with neurological changes often show lack of insight. They may say, "I'm fine," after a visible meltdown or become defensive when questioned. 5. Personality change over time. If a senior who was once gentle, patient, or socially warm becomes irritable, aggressive, or emotionally numb over weeks or months, that's not typical aging. It may reflect subtle structural or chemical changes in the brain. 6. Repetitive patterns. One bad day is normal. But a pattern of unpredictable mood swings, especially when family and friends start noticing, should prompt further evaluation. The earlier we recognize these signs, the sooner we can intervene. While emotions are part of life, unchecked volatility in seniors may be a medical, not just emotional, issue. Families should trust their instincts when something feels off, and take steps to protect their loved one's brain health. When mood swings become frequent or unpredictable in an older adult, it's critical to move beyond assumptions and pursue a structured medical evaluation. Early emotional changes may be the brain's first warning sign of decline, and timely action can preserve both emotional and cognitive health. Step 1. Document the behavior. Keep a journal of mood changes, including time, triggers, if any, duration, and how the person responded afterward. Note any personality shifts or loss of interest in social connection. This record helps doctors see patterns you might overlook. Step 2. Primary care visit. Start with a comprehensive checkup. Share your observations clearly and emphasize that the concern is not just emotional, but possibly neurological. The doctor may perform basic cognitive screening and order labs. Step 3. Blood tests. Request lab work to rule out thyroid dysfunction, vitamin B12 or D deficiency, hormonal imbalance, infections or inflammation markers. These can all affect emotional regulation. Step 4. Cognitive and neuropsychological testing. If cognitive issues are suspected, the doctor may refer the patient to a neurologist or neuropsychologist. Tests like the Montreal Cognitive Assessment, MoCA, evaluate memory, attention, language, and emotional insight, offering a snapshot of brain function. Step 5. Brain imaging, MRI or CT scan. Imaging can detect structural changes such as frontal or temporal lobe atrophy, small strokes, or vascular changes, common causes of emotional instability. Step 6. Treatment plan. Treatment may include medications, antidepressants, mood stabilizers, or dopamine-enhancing agents. Therapy, talk therapy or behavioral counseling. Lifestyle adjustments, improved sleep, physical activity, social connection. Support for caregivers, managing expectations and reducing stress. Early diagnosis allows for proactive planning and support. Emotional decline doesn't have to mean loss of dignity. but it does require action. The sooner you intervene, the better the chances of preserving brain health and emotional connection. Ignoring mood swings in older adults can have serious consequences. What begins as subtle emotional shifts may escalate into full-blown cognitive and behavioral deterioration. Left unrecognized, the underlying neurological damage can progress, silently destroying emotional insight, impulse control, and even relationships. Families often misinterpret these changes as stubbornness or personality flaws, delaying medical attention. By the time memory loss appears, valuable intervention windows may already be closed. Unchecked, mood instability may also lead to misdiagnosis, unnecessary medications, or dangerous social isolation. But when caught early, treatment and support can protect brain function, reduce distress, and restore emotional balance, preserving dignity and connection before it's too late. As a geriatrician, I want families to understand, sudden mood swings in older adults are not something to brush aside. When an aging loved one becomes irritable, emotional, or unusually withdrawn, especially without explanation, it may be the brain's way of signaling early trouble. Don't dismiss these shifts as just aging or stress. Track the changes, stay observant, and bring your notes to a doctor. Ask about cognitive screening, lab work, and possible neurological referral. Sometimes, even small medical adjustments, like treating a deficiency or reviewing medications, can stabilize mood. Equally important is emotional support. Gently talk to your loved one without blame. Offer connection, routine, and reassurance. Early emotional changes are not always signs of mental illness, but they are signs that the brain is changing. When we listen closely, we give our loved ones the chance to age with dignity, clarity, and care. Dr. Emily Carter. If someone you love is showing sudden mood swings, don't wait. Like, comment, and share this video to spread awareness. Subscribe to Wellness 60 to 100 for more trusted guidance on healthy aging. And tap the notification bell, because understanding the early signs of brain decline could make all the difference in someone's future.